Because of the presence of the U.S. military here at Coney Island Hospital, help is here.
Military medical teams are now on the ground in Brooklyn and soon will be helping in the Bronx. They were deployed to Newark last week. But this comes as New York's COVID numbers are moving sharply downward, begging the question, is this too little, too late? New York City Health and Hospitals officials say no. They anticipate certain pockets of the city will still need help for a while longer, even as the overall numbers improve citywide.
There are a lot of people who have underlying congestive heart failure, chronic obstructive pulmonary disease, and then if they get COVID, it pushes them over the line. They require hospitalization.
But the focus with the Omicron wave fading has increasingly been about how to handle the next phase of the pandemic, and if we're going to continue to need booster shots.
We're doing what we can to get people vaccinated and boosted here, but that is kind of putting a Band-Aid on what is a very large problem.
CUNY epidemiologist Dr. Dennis Nash says perhaps one day we'll be in a place where there's an annual COVID shot, but we're not there yet.
There remains the possibility of surges, so maybe before it even became a seasonal flu type thing, it might be less predictable.
Nash says in his view, the best thing we can do with the vaccine is get shots in arms around the rest of the world to stop new variants like Omicron from straining our healthcare system moving forward. The Biden administration has argued the United States can boost Americans for the foreseeable future and help the rest of the world.
I believe that we can do both, but I don't believe that we've taken steps needed so that we can do both yet. And that includes reducing restrictions on how licensing and patents can be used around the world.